So we are here doing the debriefing of the buyout that happened last week, where we got 20 more horses on the 27th of August. We tried to take care of the most critical first, so the first few horses are going to be the ones we talked about giving the last act of kindness to. So just want to preface that, so don't get super upset or sad. But if you watch the episode and see the horses, you'll understand that those horses really were in a lot of pain.
This was one of the worst months I've ever been a part of intakes at Horse Plus. And we'll go through in detail, but these horses were in really, really bad shape and a lot of suffering. So it was a very hard day and depressing day. And even the horses that did not have to receive the last act of kindness, we have some major concerns about. And normally we have another euthanasia technician available, and we didn't that day. So as we go through, Dr. Gina and I are going to take turns talking about the patients that we did intake exams on. I was doing last act of kindness for most of the day, so you'll see it's a bit disproportionate. Dr. Gina pulled the bulk of weight with diagnostics, and she and I always consult on cases if there's any questions and look at each other's diagnostics. But as we go through, that's the case. We also know that photos are really, really helpful. We are super behind and super short-staffed, and we know that people really have enjoyed these debriefings. We did not have the time to put together a slideshow for you guys, but we are going to say B numbers, and if anybody really wants to match those up, all of the photos based on B numbers are listed on our Facebook page. So you can watch this video and pull up our Facebook page and look at those photos, and we'll try to get that slideshow done next time, but we didn't have time to do that this time around. So our first B number from this group was an 18-year-old mare. She was B number B24 387, and she was blind in both of her eyes. Both of her eyes seemed to be very painful, and she was very, very fearful. She did calm down a little bit when we separated her out, but she continued to run pretty full throttle into gates, people, other horses, and then when she was stuck in a situation where she felt trapped, she would lash out, which nobody blames her for. But she was not a well-adjusted mare, and she would have needed both eyes enucleated. And because she was already blind, and it appeared that she had been blind for some time and did not seem to be well-adjusted at all, it seemed to be the kindest thing to let her go. So she was given the last act of kindness.
And our next horse is B24 388. She was a flea-bit gray quarter horse, and if you look at the footage, she was probably about 24 years old, but she was really painful. It really hurt her to walk. She was trying to lean back on her hind legs, the sawhorse stance. She was having active founder issues, and I know last week Dr. Lydia talked a lot about the founder process, and when horses are so advanced in founder and so painful that at that point there's really not a lot we can do to control their pain or help with the condition when they've rotated and sunk a lot. So we're not going to belabor that a lot, but if we had caught her early, or if a vet had caught her early and treated her, it wouldn't have gotten to that point unless she was just really refractory to management. But she also had a 3 out of 6 heart murmur, which anything 3 and above, we need to do like echocardiograms and everything to work that up. So she did have that murmur. She had inspiratory wheezes and noises in her lungs, and she also palpated abnormally exteriorly to her dental. So she would have needed to have dental surgery, which we wouldn't have been able to do that anytime soon given her status. She did have 10 cc's of Banamine, but she was still so severely painful that the last act of kindness was the best thing we could do for her to relieve her pain.
And I said this last time, it goes without saying that anything painful received pain medications immediately. So if you don't hear us say, we gave them pain meds, we absolutely did. We sedate a lot of these horses. We give them pain medications, especially if we have to do some diagnostics. So if you don't hear us say that, it doesn't mean the horse didn't receive appropriate medical care.
And the next one is B24 389. He was a 25-year-old thoroughbred gelding bay, and he was a walking skeleton. I mean, 1 is the lowest we give out of 9 on the BCS or body condition score, but if we could give decimal numbers, he probably would have been less than a 1. He was quiet, sweet, but very weak. He had no anal tone. So if you lifted his tail, there was just, normally horses can resist, and he had no resistance. And if you looked at his rear end, his sphincter was completely flaccid, and he was straining to defecate, but he couldn't. So those are all very bad prognostic indicators for quality of life. He also had decreased gut sounds in one of his quadrants. He also had a 3 out of 6 murmur, which, without working it up, I can't say what was causing that. He also had increased respiratory noises and squeaks, especially in his cranial-ventral region, which is the most dependent region. He had abnormal wear of his incisors, and he also had a small shrunken left eye with some discharge, so he would have needed to have that removed, and he was not a great candidate for that. And he also had multiple scrapes and wounds, probably from being in the slaughter pipeline and being beaten up by other horses, because weaker horses get picked on. So the last act of kindness was the option we chose for him, just because all those things were working against him for a good quality of life, and we don't want to keep them around just to say we saved him. So that was what we chose for him.
So many of these older guys are just really ready to go. Our next number was B24 390. She was another truly emaciated mare, body condition score of 1 out of 9. She was at least 30 years old, probably older than that. And she also was extremely weak. She had a grade 4 out of 6 heart murmur. So Dr. Gina said we grade heart murmurs on a scale from 1 to 6, with 6 being the most severe. To me, it sounded like her point of maximum intensity for that murmur was over her mitral valve. So she had evidence of mitral valve insufficiency. Her incisors were worn to the gum line. She had a horrible, horrible melting desmetocele in one of her eyes that was very painful. She had abnormal proprioceptive placing, so she had evidence of neurologic disease. On palpation, she had pretty significant pain on palpation across her withers. And then she was also very off in her left pelvic limb. This poor old lady. And she was given the last act of kindness.
This guy was really cute. There was like a buckskin paint that came in. He used B24 391. We aged him based on his teeth to be about 23. He was a stallion. He was halter broken, and the gentleman that had brought him on the buyout day said that he's real broke to ride, rides real well. He's a really good boy. So on examination of him, he had some mild increased respiratory noises with some nasal discharge. His gut sounds were good. He had a small right eye, or micro-ophthalmic right eye, that would have needed to have been removed. And he had some hoof problems that needed to be trimmed up. And other than that, he looked really great. We gave him all the things, and then we started to palpate his back, and we noticed that he was really reactive, and it was repeatable over his withers. So we took some radiographs of his withers, and he actually had some small chips around his withers, so he had some small fractures. And we're like, well, we'll give him some time. We took some blood to do a CBC chem because he needed to be castrated, and for our program here. And when we did his blood work, he had a pretty significant increase in GGT, which is our liver enzyme marker. It's more specific to liver than the AST that we normally see elevated with it. And on his CBC, he had increased neutrophils, and he had severely decreased platelets. So he was not a great anesthetic candidate blood work wise, but that GGT was really concerning for us given his age. Having liver problems is something that we commonly see here, which are not common in real life out in the real world, but a lot of the horses we see that are older have significant liver changes. And knowing that, with his fractured withers, it was just decided that the last act of kindness was the best thing for him, so he wouldn't keep going into liver failure and start to feel really bad. And also the concern with if he gets down and rolls with his fractures, being severely painful and refractory to pain management once that happens. So
I think this is a really good example of how Horse Plus fights to provide evidence-based care. And I think there's a lot of criticism on rescuing horses and then giving up on them quickly. And in my opinion, as a veterinarian and someone who took an oath to do no harm, I would never have recommended euthanasia on a horse like this without diagnostics, without documenting that we have not just palpable pain, but also a fracture. You always treat the patient, not the diagnostic, but in this horse's case, he had evidence of pain and immunosuppression, but we didn't make the call on him. We vaccinated him, we microchipped him until we got his blood work back and learned that his liver was also very compromised. So we don't make euthanasia decisions lightly. Dr. Gina and I never do, but because we have access to these diagnostics in-house, we were able to run this blood work in-house and have an answer by the next day. We were able to prevent prolonging suffering. Once your liver and kidneys and major organs start to go, there's not a lot that we can do. And so I think it's important just to remember we're making a lot of really hard calls, but we're doing so in an evidence-based manner, and that's what makes this job doable for us.
Yeah, he was really sweet, and we really, really liked him a lot. So that was a very hard call.
B24-392. Oh, man. This mare was about 20 years old. She was the Belgian that came in. She was quite thin, body condition score of 3 out of 9, and she had a massive left hind leg that was very classic for chronic progressive lymphadenitis or chronic progressive lymphadenopathy. If you follow Horse Plus videos, you've probably heard me talk about this disease a gazillion times, but it is chronic, progressive, incurable, but manageable. If you catch it early, you treat it aggressively with hydrotherapy and compressive wraps and sometimes anti-inflammatories and antibiotics. This mare was such a severe advanced case. Her leg was about 4 to 5 times the size it should have been. Her skin was split and infected, and she was just oozing lymphatic fluid. When she was standing on the ground, you could just see pooled lymphatic fluid just coming out of her leg on the ground. She was given the last act of kindness.
He's the thoroughbred guy.
Yeah, he's so sweet.
B24-393 is our 6-year-old bay thoroughbred. His name is JC's Champ. He's the one that we looked up, and he had actually won $12,000 when he won one of his races. Yeah.
He's a stallion.
He is a stallion, so he is on our castration list. And of course a lameness exam because he doesn't have any front shoes, and thoroughbreds typically are known for having bad feet. So we just want to make sure it's his feet and nothing else, but so far he's been a real good boy.
And he did already have a microchip from the jockey club. So it's always disturbing to see an animal that's won thousands of dollars and was likely very well bred and had a racing career get dumped into the slaughter pipeline as a 6-year-old.
And he's so well behaved. It's so sad.
Yeah.
B24-394. The Coggins says this mare was a 19-year-old that came in. She's a Tennessee walking horse, bay. She had bilateral front digital pulses. She also has DSLD and both of her fronts. We took radiographs for carpi and her withers, and she was painful in all 4 legs and feet. She had pulses found in all 4 of her limbs. She also looked like she had blown out an abscess in one of her feet too. She also had a fusion in her hocks, and she was just overall painful everywhere. If you watch the video, you can just see every step. She's just kind of like walking on eggshells look. So she did have pain management also, like Dr. Lydia said earlier, that we gave everybody who was painful pain management, and she was still very, very painful. So the last act of kindness was what was decided for her. But if you go and look at the footage, we took some radiographs and stuff, and her angles were all off, and she was just really, really painful.
And she also was super thin.
Yeah, she was a 2 out of 9.
Poor lady.
A lot of the horses we got on this buyout are very, very thin.
B24-395 was a 27-year-old stallion. He was a very good boy. He was flea-bitten gray. It's always tough with these older horses when they come in, and this guy was clearly halter broken and had been around people but wanted nothing to do with us, wouldn't take treats, just really closed off, and sometimes, anyway. He was only a body condition score of 2 out of 9, so he was very thin, and unfortunately he had some advanced melanomas. A lot of gray horses get a tumor type that is malignant, and so he had a lot of melanomas under his tail. He had some on his neck, and unfortunately melanomas can also be present in other parts of the body. He also had a very painful mouth and pain on his back on palpation, and he was actively trying to chew and just dropping feed. So when we looked at his teeth, he had multiple missing teeth and not enough of an occlusal surface. So we try not to make decisions based on necessarily one thing, but even if this horse was a 7-year-old with the number of tumors and the size of the tumors, and then combined with the fact that he didn't have teeth, we made the choice to let him go. Also, getting castrated as a 27-year-old would be really tough, and that's not a decision that Dr. Gina and I make. That is one of Horse Plus's policies, as determined by our board, that we do not adopt stallions out to anybody. We do not transfer them. There's a lot of horses that don't have good homes. So our decision is always, is this animal a good enough anesthetic candidate, and is their quality of life going to be enough? And we do frequently castrate older animals and get them to adoption, but this guy was in a lot of pain and his prognosis was poor, and he was given the last act of kindness. B24-396 was an 18-year-old standardbred mare. She had a brand on her left neck, so we were able to verify her age, and she had very severe DSLD. That's deep suspensory limb desmitis. You probably hear us talk about it. That is also a chronic, progressive, incurable condition. I had a horse with DSLD, and in the last year of his life, he was on 4 different pain medications before I let him go. So if your horse has a pretty mild case, it's something that can usually be pretty easily managed. This mare's case was pretty severe. She had, when she was chewing, she had this really weird fluctuant swelling above each eye, and so often we think about a problem in the guttural pouches or the ethmoid cavity or something related to the mouth, and so we were able to determine that she had a fractured upper premolar. So she had broken a tooth, and that had created a fistula between the mouth and the upper part of the head where there's not supposed to be communication, and she had some smell and discharge associated with that. We do a lot with dentistry. We do the best job we can, but when we have a fractured tooth that already has a hole up where it's not supposed to be, it's a very, very challenging thing to correct. She also had a very deep puncture wound in her right hind leg that appeared to be right over the level of the hock joint. And because of the poor prognosis of all 3 of those things that I mentioned, she was given the last act of kindness.
She was real sweet. The next one is B24-397. He is a 2-year-old quarter horse stallion. So he presented with a microophthalmic left eye. So he'll have to have an enucleation on that eye. He'll also have to be castrated. And he got all of his microchip vaccines and his dewormer. And when we released him, because we had only seen him in the chute, but once we released him, we realized on his left hind leg that he has string halt. So he is one that we are concerned about long-term quality of life. If he's already having that severe of a show of string halt with his enucleation and his castration, we're not really sure if he'll be a good candidate for long-term quality of life. He'll have to be a pasture pet, so that he is one that we are concerned about quality of life long-term. But he is right now in our big boy pasture.
We have a lot of horses that come in with lameness, and as long as we are comfortable saying that they are stable enough, we always try to turn them out. Sometimes we give them daily pain meds for that quarantine period. Sometimes we move them to our hospital, but we always try to see if they can pass a more advanced lameness evaluation. We never want to turn something out that's going to be painful on a daily basis. And so you might hear us talk about, oh, this horse was lame, and somebody thinks, why are they kicking that horse out? But, we do as much as we can in the moment to make sure that that horse isn't going to be uncomfortable during that quarantine period.
Well, this is a neurologic guy.
Yeah. B24-398 was a 2-year-old Mustang, and this horse is one of the most neurologically abnormal horses I've ever seen. He had this is my notes, but you and I both saw this case.
Yeah.
He had what we call a doll's eye. Do you want to?
Sure. The doll's eye test is a neuro test you can do where you lift the horse's head and their eyes are supposed to go down to look at you that way, and you're supposed to see the whites on the top. Him standing straight with his head in normal position with a little head tilt, he had that. So he was already abnormal just by looking at him. His eyes were ventrally changed. Instead of looking straight out like horses normally do, they were rotated down. So his doll's eye test he was doing it already with standing in a normal position, which is abnormal.
Yeah.
They are not supposed to look like that.
And he had a head tilt, so he was constantly holding his head to the left. We were able to take radiographs of his head, and we also did a cerebrospinal tap. And what we found in the cerebrospinal fluid were floaters, basically. So our top differential is bacterial meningitis. And he was given the last act of kindness. Anytime we have neurologic disease in a horse, there are some scary things on that list. In this horse's case, wobblers was one of the possibilities. Wobblers is a condition where congenitally they have too much space between the atlas and the axis, and it can throw off that brainstem and coordination. In this horse's case, due to the appearance of the CSF, I think meningitis, bacterial meningitis is probably the most likely thing, but because he was a very unhandled young Mustang, and because a lot of the things on the list of neurologic disease make them an infectious disease risk to humans and to other horses, he was given the last act of kindness. It's a tough one. We don't have a definitive answer in this case. We didn't send off for more diagnostics on that CSF fluid. Horse Plus always has to be conscientious of what we spend, and in this horse's case, knowing definitively what bacteria was in there wouldn't have changed the outcome in this case.
Next we have B24-399. He is an 18-year-old stallion. He's the bay boy that has the star on his forehead. So far, he's doing well. He's out in our pasture of stallions waiting to be castrated. We're going to do a complete blood workup on him first to make sure he's a good anesthetic candidate. And when we were running him out after he got his microchip vaccines, all those things, we noticed that he's just a little different on his left hind than his right hind. He's gated, so we're not sure if that's because he's gated or if there's truly something more lameness-wise there. So we're going to lameness work him up and then do his CBC chem. And then if all that checks out, we will castrate him because he is a good boy. He's very sweet.
Wow. B24-400 was an 8-year-old Mustang gelding. You guys know we lost Corey, so our team is down a horse handler, and our team did a really good job managing this horse. Sometimes we have horses that are truly aggressive and dangerous for everybody involved, and this particular individual was biting and striking other horses and humans in the vicinity. He was attempting to jump panels, and he just was absolutely dangerous and aggressive. So these are tough ones, and we kind of met as a group. We actually had other organizations present who were here for retreat, and I think there were like 8 or 10 people up there. I don't ever want to give up on anything too lightly, and behavioral calls, especially during intake, are really tough. We try not to make them, but we also have to keep our staff safe, and we don't have the ability to quarantine every horse as an individual. We have to quarantine horses as groups. We had a lot of Mustangs come in, and this horse was at risk of, at one point I was worried he was going to break his own legs or neck with how absolutely dangerous his behavior was, and he was given the last act of kindness.
B24-401 is a 3.5-year-old mare Mustang. She's a sorrel. She has some nice white markings on her as well. She was very scared on intake day. If you tried to look at her teeth, she would try to bite you. So I don't blame these Mustangs, though. They're from a wild lineage. They're used to being unhandled and free, going wherever they wish, and now they're stuck dealing with people that they're not used to doing. So we don't hold it against them. We understand that they would rather be wild, and we wish they could be, but safety is always our top concern.
And there's a big difference between fear, that like fight or flight response, and overt aggression. And unfortunately, our team has a lot of experience with both. But an animal that is afraid and has been through a traumatic experience often just needs decompression and gentle handling. And we have a chute system that lets us manage these animals very safely. And so as we talk about these Mustangs, they were all very bonkers and very afraid to be there. And our team was able to safely examine them and get them the things that they needed. So just saying this animal was dangerous, it is certainly not always grounds for euthanasia. It's a really hard call to make. So a lot of these Mustangs we processed, and we've actually reached out to a Mustang rescue that specializes in dealing with these guys that are, they're tough to manage, but they can be amazing horses. So we're hopeful to get a lot of them into good homes.
Yeah, but we were able to give her everything but well, it says we got strangles, but she had a fever. But we don't know if that was just because she was working herself up so much, because she was very nervous, very flighty, trying to jump panels. So she's on our list if we can safely do so to preg check her, because she did come in with a bunch of stallions. But she did get all of her vaccines and her microchip. So, oh yeah, and this boy, B24402, he was chipped, but it wasn't registered. He is a 5-year-old-ish Mustang gelding. We're not sure about his age. He was so scared and nervous and wild that even in the chute, we couldn't actually look at his mouth to try and age him. He would dog sit, try to flip over backwards, go down in the chute. So we just didn't want to stress him out too much. We just tried to do the least bit necessary for him to keep him from being so scared. So he also had a temperature. His temperature is 104.8. So he did not get his strangles, but he did get his microchip, his rabies, and his 5-way. And once we got those in, we let him go out to decompress.
And part of our job, as we're having horses come in here at Horse Plus, we want everything to be adopted. But Dr. Gina and I always have to think, what would we do if this horse colicked? Or what would we do if this mare is pregnant and she's foaling and she has a dystocia? There are some very, very basic things that even a pasture pet needs to be able to do. You know, you have to be able to catch them. You have to be able to pick their feet up. And so we're always playing this balancing game of, you know, we always want to trust that other people are going to do the right thing. But if we're listing animals as adopted and even transferring them to other rescue organizations, we want these animals to have an excellent quality of life. And that includes, you know, freedom from discomfort, freedom from major health concerns. And so we're always trying to balance things. Our job isn't to make people happy. Our job is to practice good medicine. And so, you know, some of these are tough ones. Some of the animals that have very healthy, amazing brains have really broken bodies, and sometimes it's the other way around.
B24403 is the next one. He was also a Mustang. He was about 15 based on his dental age. He was also another one that was very dangerous. Like, he would walk past our handlers, like Haley or Emily, and he would look at them, and then once he got past them, he would target kick at them on purpose. And it was unprovoked. They weren't flagging or doing anything to try and get him to move. He was just simply walking past them and chose to kick at them. So that was a very dangerous behavior for us, and we had great concerns. And even when we got him in the chute, he would rile up. Anytime you would approach him, he'd be calm if you'd leave him alone, but anytime you try to do anything with him, he would kick, bite, rear. He would do all sorts of stuff. So he was a very dangerous boy, like the one that we had saw before. So he was given the last act of kindness because he was just too dangerous to keep around, especially going after people.
And both of those Mustangs that we had to give the last act of kindness to had similar brands. And so we don't know if they were used in a rodeo context or what their history was. But both of them crossed that line of just being afraid and attempting to escape and actively targeting opportunities to inflict harm on humans, which we don't blame them for.
B24404 is a 4-year-old Mustang gelding. He's a body condition score 4 out of 9. He is a bay. He is also another one that will bite you if you give him the opportunity. But he was relatively okay when he was in the chute, so he was not aggressively seeking us out. He was just more reactive. So he came with a microchip that also was not registered, but he got his rabies, his 5-way, his strangles, and he was dewormed and then released out with his buddies. B24-405 is a 3-year-old gelding quarter horse, sorrel. He's little. He's about 13 hands high. He's a pretty skinny boy. He's a 2 out of 9 body condition score. He had some nasal discharge, and he had some superficial wounds, especially on his hind legs that he was bleeding on, but they were very superficial. So we didn't try and treat him because he was also very fearful and scared of us. And once we released him out after he got his microchip vaccines and dewormer, he was released out with the Mustangs because that's who he came in with. He also showed evidence of lameness, so we are going to try and recheck him this week and see if he's still lame and if he's worse, better, and manage him from that standpoint. B24-406 is a 5-year-old mare Mustang. She's a bay. We have concerns about her. When we got her up in the chute, she had evidence of eye problems. Haley was like, her eyes look kind of cloudy. So when I came to examine her, and I also pulled Dr. Lydia in for her opinions, we do something called the menace response, where you take your hand and you don't hit the horse, but you bring it up kind of quickly to see if they can blink. It's a vision also with a neuro test combined, and she would not blink. She actually would not be able to close her eyelids at all. She was visual, she'd react, but she wouldn't close her eyes. And then when you shine a light, there's a pupillary light response that you check for to see if the pupils will constrict in response to light. And her pupils, for me, did not restrict at all. And Dr. Lydia came over and gave her a little bit more time, and she had very minimal response. So it's very reduced to absent, which are both very abnormal findings. So we're trying to decide if she needs more of an opto workup based on vision impairment or if it's more of a neuro problem. So you have to decide if it's a lesion or if it's something within the eye itself. So we are concerned about her with that, and her feet need trimming. But out of all the Mustangs, she was one that we could actually get a halter on, or Haley got a halter on and is actually able to walk her around. But we're very concerned about that, and she'll need to be worked up for that. I think she was our last one.
Mm-hmm.
So
It was a pretty depressing intake day.
But like Tani says, it's better for the horses to come here and be humanely given the last act of kindness, as opposed to going to a foreign country and dying in a very inhumane, painful manner. So even though a lot of the horses were in terrible shape and we gave them last act of kindness after some pain meds, we did it in a caring, loving way the best we could, given the circumstances, so that they were not living out a long time life of pain.
Tani wasn't here during this intake group, so normally we've been having one of the vets be here with Tani. Thank you guys for listening. If you can't tell, this is tough for us. This is a very emotionally taxing job, and we want our supporters to have full transparency on what happens to these animals. And it's also, it might sound like we're justifying decisions. I personally don't feel that way. I don't feel like any of the cases that we see need justification, but we know that we also have supporters who love these horses and who fall in love with them on site, like we do. And we want you guys to have the information about what happens to them and our thought process as we go through. I didn't say this at the beginning. I kind of dissociate a little bit because I'm a crier, and I had to euthanize all of the horses that we made the decision on in this group. And so if I allow my emotional body to be present, then there's a lot of tears and I don't get through things. So if you're new to this and want to know more, we talk a lot more, and then we'll try to pair them with pictures. We do have all of our intake filmed. Some of it is filmed. And so what you just heard us talk about is available to the public via camera. So you can see us working with those horses. Some of the horses that looked very painful, you can see them walking. You can see us taking x-rays, and we try really hard to be fully transparent. And I think one of the things that gets lost often is that an animal that comes to Horse Plus and is humanely euthanized is still rescued. The animals in the slaughter pipeline go through a lot of suffering for days and days and days, and often they come to us having been at 3 or 4 auctions, and then they spend days in a trailer, often with no food or water. A lot of them have fractured limbs or really severe disease processes, and then after all of that, they die in a really inhumane manner. Sorry, that was a fly. And so it's really hard for us. We're here because we want to save them, right? We want the fun surgeries and the happy outcomes and the adoptions, but the reality is a lot of these animals need to be rescued and allowed to let go, and especially a lot of these older horses. They're so thankful. They're thankful for somebody being there and for ending that suffering, and it's a really important part of what we do as well.